Nearly 1 in 5 Black adults in this country have a mental health illness, but only 1/3 of them are actually receiving any type of treatment for it. And I could probably stop right there. I could probably stop and say, hey, that's a problem. But today we're going to talk about why it's a problem. We're going to talk about why it's overlooked, underdiagnosed, right? Because one in 5, I think it's probably higher. And more importantly, the fact that only 1/3 of those are actually receiving treatment. And when they do receive treatment, it's not the most adequate treatment. Yeah, we got to have a whole discussion. So in the month of July, this is Minority Mental Health Awareness Month, and I think we got to talk about it, right? Yeah, and obviously, right? I got personal ties, right? I'm a minority right here in this country. I am married to a therapist, right, who talks about mental health all the time. So I think it's important for me to understand the importance of it. And if you've been following the Lunch and Learn for however long you've been following Lunch and Learn, first of all, shout out to you. You know that we definitely try to incorporate the importance of mental health with everything we do, right? Because again, it doesn't matter. You can have all the physical health you can get. You can have all the financial health you can get, even the spiritual, right? If the mental health is not there, it does not matter, right? Like those are all my components of having an adequate life, especially when we talk about optimum health, right? So let's talk about it. Let's talk about why so many people are not being diagnosed here in this country and what we can do about it. All right, so I like to start out, especially when we have these types of discussions, because a lot of times we talk in like theory and like conjecture and kind of like, oh, imaginary stories, right? But like there's real life stories that I take care of quite a few patients. I have quite a few friends who deal with a lot of just the mental stressors of just what life throws at them. And these are people who are successful. These are people who have degrees and jobs. They have children. Like these are people who are quote unquote living the American dream, but the amount of stress that continues to be placed on them wears them down, burns them up, right? We talk a lot about burnout here on this channel, especially when talking about physicians and just healthcare workers in general, right? But I can tell you there's a population in this country, especially Black folks, who have been experiencing chronic burnout, chronic stress, chronic mental fatigue for as long as they can remember, to the point where now they just assume it's normal, right? How many of you assume that the stress you're dealing with, you're just supposed to be dealing with, right? The burnout that you're dealing with, you're supposed to deal with burnout. You know, there's this imposter syndrome that you're dealing with, you're supposed to deal with that. No, that's not true. But unfortunately, when you've been ingrained in a society that makes it seem that if you are Black, there is a sense of stress that just has to come with it, to the point where when we see other Black adults or just Black children who may not necessarily come up through what we call the struggle, right? We look at them weird, right? We say, oh, you didn't come up through the struggle. Like you don't know what it's like. Like it's almost looked at as a badge of honor if you're forged into this life of, you know, being a child and more importantly being an adult, but there's been stress all around, right? Like I think that's a problem, right? We talk about this, right? This is important. We talk about cultural stigma, right? And I want to make sure we get this. Deep-rooted mistrust of the healthcare system and a lack of Black mental health professionals leads to the fact that only 1/3 of the 20% of Black adults actually get diagnosed, right? This is in the psychology workforce in the year 2023. And that's a problem, because not only do you have the cultural stigma of what appropriate mental health is, when you do decide, hey, I want to do something about it, and you go to try to find someone who may follow some of the cultural, you know, mannerisms that you grew up with, you can't find 84%. And I tell you all the time, especially in the healthcare field, the likelihood of you finding a Black doctor, right, to take care of you for your life is very, very low, right? Because there's just not that many of us, and especially just in healthcare. So when we do get in healthcare, you know, some of us become internists, some of us become pediatricians, some of us become OB-GYN, some like we're spread out, right? So the likelihood of you being able to have, you know, a Black internal medicine physician or family physician, a Black pediatrician, a Black cardiologist, like it just, I don't want to say it can't happen. It just obviously depends on where you're at and how hard you work, but boy, it is a struggle. So think about it in the mental health realm, where even within the Black community, we can kind of recognize, hey, I should go and get checked out for my diabetes. I should go and get checked out for my high blood pressure. I should go and get checked out because my back is hurting. But we don't have that same energy to say, you know what, I should go and get checked out because I'm feeling depressed. I should go and get checked out because I'm extremely anxious when I'm in, social situations. I should go and checked out because like I'm feeling a lot of grief after the death of my family member. Like we don't have that same energy to go get checked out. So that's why that drop off is so significant, right? Because it's this stigma that we have internally. And that's why I like a month. Anytime you have a month that like highlights a disorder, right? I know it's for good reasons, because if you don't do that, like we'll act like it's not a thing, right? We'll act like, minority mental health awareness isn't a thing because we don't highlight it. But it's such an important conversation. And if we are going to get to the root of the problem, which I think a lot of it does stem from culturally how we feel about mental health, having these types of conversations, watching these episodes, listening to them on podcasts just ain't going to work, right? Like we have to get to the point where we are just as comfortable talking about our mental health, talking about the stressors that are around us, being able to combat any stigma that says we shouldn't focus on our mental health. We have to be just as comfortable doing that as we are when it's like, hey, let me go get my blood pressure checked. Let me go get my diabetes checked. Let me go, try to lose some weight. Like we have to be just as comfortable and as confident in doing so. And I can tell you, even as a physician, this isn't a journey that just kind of came into fruition, right? I tell this all the time, right? Whenever I start touching on mental health related topics, a lot of it really is due to the fact that in my close proximity, I have someone who focuses on mental health. Like that's what they do, right? Like they're mental health therapists. That's what they do. They focus on the aspect of mental health. And it makes me such an amazing physician because it allows me to be able to step over barriers that were invincible, that I didn't know it was there, but it allows me to hop over them. Versus when a patient comes in and they're just talking about the blood pressure. Yeah, I talk about the blood pressure. Yeah, I give them some tips on what to eat, what not to eat. But I don't ask them how's the home life, right? I don't ask them what is it like, with the stresses at work? How are the kids? Like these are questions that don't typically come about. But once I recognize, this isn't a journey that I just fell into and I was ready to run, right? I had to work my way up to it. And when I talk to my physician colleagues, I really try to champion the fact that like, hey, remember, like, that patient who you may call non-compliant may have a lot of stressors at home that says, hey, you know what? I got to pick and choose whether I'm going to take this medication that I know could save my life or feed my kids, right? I got to pick and choose whether I take this medication or go to that doctor, right? Because my primary referred me to it, or I got to put gas in the car to make it to work, right? Like these are decisions that people are making on a day-to-day basis. But when we come and we see them in our office or in a hospital setting, in a nursing home, right, we kind of see what the end result of their decisions are. And we have to be able to look through the end result and say, hey, what are some things that probably caused you to get here? So when I talk about mental health, especially in the Black community, like we did that episode focusing on Meek Mill's episode, right? Which was actually a very fun episode. And we actually got requests to do other people's song, which we may do, right? Like, hey, why not, right? We may do. What was interesting about that episode and just having a conversation around the episode is you have this hip hop star who talks about like just grief and anguish and anxiety and depression, all kind of wrapped up in a song choice. And sometimes that's the way we have to kind of get things out. But not everyone's a rap star. Not everyone's, a singer, right? Not everyone can get it out musically. So we have to figure out what are some of the ways that we can do, especially in the Black community. What are some of the ways that we can address what's going on and just not brush it to the side? Because when we brush these things to the side, when we say, all right, the stress isn't that bad, the anxiety isn't that bad, the depression isn't that bad, the grief isn't that bad. When we brush these things aside, it ultimately shows up in the office. It ultimately shows up in a hospital. It ultimately shows up in the nursing home. All of a sudden, that blood pressure regimen just does not work for you, right? It does not matter, right? Your stress levels are so high, it doesn't matter. Your pressure is always up. Even though your doctor's throwing 1, 2, 3, 4 medication, it does not matter. Your pressure controlled. All the issues with your grief that you thought you got over a year ago, you're still dealing with the grief. And the reason why you thought you got over it because you stopped talking about it. It's not like you did the things needed to make sure you got over the grief or became the person you needed to be to move forward with the grief. That's important. You just figure, all right, if I don't talk about it, then everything's all good, right? Like, so there are just certain like factors that we need to continue to work on if we are going to get to the point where when 1 of 5 Black adults are known to have some type of mental health disorder, all 100% of those actually get and seek some type of treatment. Like, because that's such a significant fall off. Because like I said, I think the 1 in 5 is not an accurate number. I think especially Black adults, have done such a great job, just Black people in general, have done such a great job being able to mask when they are dealing with life being life, right? They're able to just mask it in ways, whether you're in corporate America, whether you're in school, whether you're out of school, whether you're just at work, whether you're an employee, whether you're a boss, right? Whether you have no job, whether you have, like 10 kids, 1 kid, it does not matter. All of these different spectrums, we have found ways to be able to kind of master stressors. With Meek Mill, like the post-traumatic stress aspect of losing his father in a traumatic way. How many times when we see these children, right, and these children become adults and they have these behavioral related issues, that we ever say like, all right, the behavioral issues, maybe they're stressed, maybe they're angry. Like, we don't give them that, right? We always put this like, all right, like that's just like, he's just a deviant, he's that. Like, that is the labels that get put on us, right? We don't get the labels of, all right, you know what, maybe he's dealing with post-traumatic stress disorder and he's just acting out. No, he just doesn't like school, right? Like, these are the problems that need to be rewritten, especially from a healthcare perspective side. Like, these are the things we have to recognize. These are the things we have to be able to kind of shout out from the rooftops, because if it's all about the pathway, right? We talk about his journey. It's all about the pathway. If I set you up appropriately and I say, hey, you know what? I think you have depression. And because I think you have depression, I think you need to see those people. I think you need to talk about these things here. And once I know that you've gotten to the point where like, yep, you're good, all of a sudden you're miraculously way more compliant on this side when it comes to taking care of your blood pressure, taking care of your diabetes, taking care of your cholesterol. All of a sudden you take your medication. All of a sudden you get all of your follow-up appointments, right? Because I'm helping address this side. But if I act like this side doesn't occur, then I have to make up reasons why the other side is not functioning. And I think that's really where we've gotten in trouble, especially in the healthcare field, is that because we don't even think about, we call it differential diagnosis, right, in medicine, right? When we're trying to figure out like all the different possibilities and causes of your complaints that leaves you, that cause you to be in front of someone in their office. The differential, like we never put mental health or mental health stressors as that top differential, right? Where there's always a basket of things we may put over it before we recognize that, hey, you know what? You might just be stressed. You might just be burnt out, right? You may just be extremely anxious. You might still be dealing with that grief that you thought you were over. Like, we have to do a much better job, especially if as the healthcare provider and the patient, we're going to get them to where they need to get to. And we'll talk about that. All right. So how do we get there, right? How do we move forward? Obviously, Mental Health Awareness Month is a thing where, yes, you scream it from the rooftops, but then there should be some action that flows right behind it, right? There should be something that occurs after you recognizing, hey, this is the issue, right? So, and this is, I love this, right? I actually got this from an article that talked about, first thing what we're doing is we do what we're doing now, right? We talk about it openly and we talk about it often. So yes, the month of July, you may see flyers, you may see articles, you may see presentations about it, but more importantly, what happens once that month is over, right? The month of June is Men's Health Awareness Month, right? So, right now, this month, we're going to be, in the month of June, they're going to be talking a lot about men's health awareness, right? The men's mental health awareness, right? But when you have a whole month like July and it's all about minority mental health awareness month, right? Like, yes, you talk about it during that month, you hammer it home during that month, but come August, I still need you to talk about it. Come September, I still need you to talk about it. Come December, around Christmas time, I still need you to talk about these things. So we have to be able to scream it from the rooftop when it's time, right? And like in a month like this month, it's time. But when that month goes away and the flyers disappear, we got to understand that our mental health illness is still a problem after the fact. We got to understand that like recognizing it and talking about it and discussing it is still a thing we need to keep on doing throughout the year. It has to be a year-round thing. And again, that's why I like when you have these awareness months, because it becomes hyper-focused where everyone has to talk about it. But more importantly, it helps, for a lot of people, it helps start that engine to keep talking about it when it's all said and done. Like that's first and foremost, got to talk about it. Got to talk about it often. If you can find, and this is a big one, right? Finding culturally competent providers, right? And I say culturally competent providers. Obviously, we're talking about Minority Health Awareness Month, but that doesn't mean that you have to find a provider that's a minority, right? Like I wish it did, right? But the problem is, and just kind of we discussed earlier, the numbers don't favor that. If you're Black, either you're a man or woman, doesn't matter, right? the likelihood that you're going to run into a Black professional, right, who can help you, especially from a mental health awareness standpoint, is extremely low, right? Like, of course, we have platforms like Therapy for Black Girls. We have Daniel's Harbor. We've had Naisha Garzon here, the grief counselor, right? So there are like pockets. There are pockets of areas where you can get these things at, but it got to be important. Black Mental Health Alliance, right? These are just things that, again, I'm listing, right? And I'll put links in the show notes for it. But it's important to understand, like, yes, we can have, good things, right? We can have like the providers, right? They just need to be culturally competent, right? And if they happen to be Black, great, right? But the likelihood is, and that's why I don't want to set you up for failure, right? Because I think especially people who watch me, right, or listen to me on a podcast, right? They understand that one of the novelties, right, associated with me, right, is they're not used to seeing a Black male physician. They're just not used to seeing, and I hate it, right? Well, I love that I'm the one they do see, but I do hate it that it's almost like an oddity, like, oh my God, look, it's a Black physician? Wow. Oh, and he's educating, right? Like that's not something that they're used to. So you have to understand that it's not too many Dr. Pierres around, right? Like there's not too many Dr. Pierres who get online, who educate their community, even though the community may be someone that they never see, right? Like there's the amount of people who listen to my content, and I check, right? I got people listening to my content in all the states, multiple different countries that they're downloading podcast episodes, man. Shout out to y'all, first of all. Shout out to y'all. But I understand that, like, I can't talk to everyone, right? I can't touch everyone. Right? I literally can't be everyone's provider. So you have to be able to like find a Dr. Pierre near you, right? You have to be able to find, again, a Therapy for Black Girls, a Daniel's Harbor, right? A Black Mental Health Alliance, right? You got to be able to find these organizations and these services around you, right? Because we can, and especially because a lot of them, especially in this digital age, are online, right? So we're trying to eliminate the barrier of like, hey, there isn't someone down the street from me, right? Because the likelihood of that happening is even smaller. This is what it is. So it's important for us to kind of find these providers and know where to find them. And then we just got to push for systemic change, right? 11% of U.S. counties have enough mental health providers to meet the demand. Let me repeat that. 11% of U.S. counties have enough mental health providers to actually meet the demand. So I know it's not just the patients, right? Like the patient who may want to get some help, who may want to have a conversation about their stress, their anxiety, their grief. The likelihood that they're staying in an area where there's enough mental health providers, right, to meet the demand is terrible. So this isn't news, right, y'all? If y'all been following me long enough, y'all know that we've been calling and screaming for more mental health providers, right, and the need for them, right, to be as culturally competent as possible and to have online access, right, because like they can't get in touch with you, right? It's important to do these things because the numbers aren't there, right? So we talk about it. One, we find some culturally competent providers. Two, right? And then we have to push for systemic changes, right? So that your local municipality has enough mental health providers, right? Your county has enough mental health providers, or you're able to get online and get access to all these amazing mental health providers online, right? Like it just is what it is, right? It just is what it is when you're trying to like change, right? Because it's one thing to talk about it, right? Which we're all doing because this is the month you talk about it. It's another thing to take action with it and then change for the better. All right. And so I want to talk about some things I want us to avoid, especially before we get up out of here. One thing I want to do, right? I want us to avoid these two issues that I see happen a lot, especially in the Black community when we're talking about mental health. This conversation or discussion that, it's just a phase and they'll get through it. Right? No one says, hey, you just have high blood pressure. It's just a phase. Hey, you have diabetes. It's just a phase. But for some reason, when a person is depressed, when a person is anxious, when a person is dealing with grief, right? And they're dealing with those mental health stressors, post-traumatic stress, when they're dealing with these stressors, we keep saying it's a phase. And the reason why we do that is because we assign a time to it. And we say, hey, by this time frame, they should be over it because I don't want to hear about it anymore, right? Be honest if you do that. Like, oh man, come on, it's been 2 months, it's been 4 months, it's been a year, right? We assign time frames to things that may be lifelong, right? So one thing I want to do, I want us to avoid, especially in our Black community, I want us to avoid this conversation that these mental health stressors and disorders are just a phase that will just get by, right? We do it with the kids too, right? Obviously, I'm talking about the adults. We do it with the kids as well too, right? Understand that the kids be crying for help and we don't be listening. The adults be crying for help. We don't be listening. But again, if you're following this channel, like that's going to stop today. The next one, and I think I'm almost sure I have a podcast episode on it. I'll just lean on family. I don't want none of y'all to, unless you happen to be a counselor, and even if you're a counselor, I don't want you to be your family's counselor, right? I have an episode where I talk about stop being the family counselor, right? Stop looking for that one family member who you think is strong, so you dump all your emotional weight and baggage on them and then you just leave. No, don't do that. Like, we're not doing that anymore. We have professionals who are trained to take on a person's emotional baggage and not allow it to drag them down. Your family member can't do that. Your family member can't do if you dealing with all of the stress, the anguish, right? Those secrets that are weighing you down, right? Like, your family member is not equipped for that. Stop telling them that so you can get the weight off your shoulders and give it to them, right? That's selfish. That's greedy. We're not going to do that. Not in 2025 and beyond. That's not happening whatsoever, right? So I don't want to hear two big issues. I don't want to hear about you thinking that this mental health issue is a phase and you got a clock that's just waiting for them to quote unquote get over it. And I definitely don't want you to hear that you've been dumping all of your problems on your aunt, your cousin, your uncle. Like, nah, we're not doing that. Not in the year 2025. Like, if we are actually trying to get better, if we are screaming from the rooftop, hey, it's Minority Mental Health Awareness Month, what are we going to do here? We are going to do better. If we don't do nothing else, we are going to do better. And we can't do better, right, unless we talk about it. We can't do better unless we recognize it. We can't do better unless we're talking to the right professionals, culturally competent, I hope, right? We can't do better unless we do these things, right, to get better. Right? We're not going to call it a phase. We're not going to dump on our family. We're not going to do these things. Not no more. Right? Because it becomes an issue. And again, I talk about this. When the mental just isn't there, nothing seems to work. Right? Nothing seems to work. Your personal life, your career, job life, all of these things don't work appropriately when the mental isn't there. And I don't want that to continue to be a case where we act like, oh yeah, everything's all cool. Right? Yeah, everything's fine. I got no problems. I got no stress. Fam, your mom just died. Your dad just died. Like, you just lost your girlfriend of 10 years. Like, what are you talking about? What are you talking about? You're fine. You are not fine. And it's okay to say that, right? So when as we sign off, I want everyone to think about during this month, but and beyond, what am I going to do to make sure my physical health, my financial health, my spiritual health, and more importantly, my mental health is in pristine shape for the rest of the year and beyond.